morning, the doctors. So today we're going to talk about this bruise and blood clot, the difference between these two. Okay, do you have any idea what it is? Vamos a hablar hoy sobre lo que es estos, bruise and blood clot, hematoma y coágulo. Okay? Okay, this is a review in August 21st, 2018 by John and Johnson, and a review by Judith Marcin, MD. Bruise versus blood clot causes. Okay? Okay, how to tell if it is a bruise or a blood clot. Vamos a ver la diferencia entre estos dos. Okay? Continue. Bruises and blood clots can both be the result of damage to blood vessels. Entonces, afectamos los vasos sanguíneos. Okay? But its causes and symptoms can vary. Y es lo que vamos a ver, las diferencias. A bruise is a noticeable mark on the outer layer of skin due to capillaries bursting in the area. The capillaries are bursting, and then they are making these colors appear, okay? When an injury occurs to blood vessels, such as damage from a cut or impact from a blunt object, blood leaks out of the blood vessel into the tissue around it, okay? In this condition, all the platelets are coming. Okay? Well, first we're going to talk about the bruises or hematomas, okay? A bruise can form after a hard impact, touch, an injury, falling down, or breaking a bone. As we can see, the color of the skin is changing, okay? Or even if we have a broken bone. The burst blood vessels leak blood, which becomes trapped and decolored beneath the surface of the skin, forming the bruise. Okay? Just as we can see, there's a different color here, but just be careful. These are not. These are bruises, but these are called hickeys o chupetones, ¿verdad? Okay? Es un tipo de hematoma. Okay? The black and blue appearance of a bruise comes from the lack of oxygen in the trapped blood, okay? La falta de oxígeno nos da la coloración azul, okay? The site of the bruise will appear reddish at the first, then turn to dark blue, purple, or blackish color over the first few hours to days, okay? So we can see the stages, the reddish, purple, blushes, and finally yellowish until it fades totally, hasta que desaparece, okay? So we can see the different colors between the days or by the time passes, okay? And as we say, the bruise will change color as it heals, se va sanando, typically getting lighter and more yellow until it resolves over the time and later fades completely, okay? Okay, what are the risk factors for bruises? Okay, some drugs, including blood thinners such as warfarin, and over-the-counter drugs such as aspirin. Wait. Do you know what is over-the-counter drugs? ¿Saben qué son estas medicinas? Si lo traducimos literalmente, estamos diciendo que son sobre el contador, ¿sí? Bueno, estos medicamentos son aquellos medicamentos de libre venta que nosotros podemos encontrar en Walmart o en la tiendita de la esquina, ¿sí? Y por lo tanto es importante conocerlas porque precisamente como son de libre venta, es muy fácil que los pacientes las puedan tomar y tener este tipo de riesgo, ¿ok? Fish oil supplements, some vitamin. Deficiencies or bleeding disorders may also make a person more prone to bruising and bleeding. And aging tends to make the skin and blood vessels more fragile. Okay? Aging se refiere al envejecimiento. Age, edad, aging, envejecimiento. Okay? A blood clot is a clump of blood that has formed in deeper tissue or within a blood vessel and is rarely visible. Okay? Ahora vamos a hablar de lo que son los coágulos. Okay? As we can see. Okay? Blood clots are part of a natural process of healing after an injury. Okay? So the process began with the coagulation, the formation of a blood clots when the platelets come, when there's a broken bone or the tissue or the skin, and then the platelets will come, make the clump to stop the bleeding. Damage to an area causes platelets to collect and clump together in the injury, which helps to stop the bleeding. Okay? A blood clot can also occur inside a blood vessel, in which case doctors will call it a thrombus. This is a very, very special thing and a very, sometimes will become an emergency, okay? So we can see the blood flow comes and then it makes the thrombus. Of course, the flow will be like narrowing, okay? High blood pressures, diabetes, can damage the lining of the blood vessels, resulting in a thrombus forming. Blood clots can form on their own within a blood vessel due to the hypercoagulation, sometimes blocking the flow of the blood and oxygen to part of the tissue. Okay, so as we can see, the clot is formed here and it's blocking totally the flow of the blood or even the oxygen supply. Blood clots within blood vessels are always a medical emergency and can become life-threatening due to the obstruction, and it can cause severe damage or death to the cells. ¿Pueden pensar en alguna situación en la que esto se presente? Donde el flujo de sangre está interrumpido y no hay oxígeno. ¿Alguna idea? Okay. A blood clot formed when blood cells and fibrils stand clogged, and a clot that blocks blood is called a thrombus. Okay? Some examples of severe conditions that a thrombus can cause include stroke, okay? Heart attack, okay? Pulmonary embolism, this part, mesenteric ischemia, and deep vein thrombosis. Okay? Todos estos ejemplos como un coágulo puede comprometer el flujo sanguíneo y dar un verdadero problema. Por eso se dice que son emergencias médicas. The risk factors for blood clots. Sitting for prolonged periods may increase the risk of blood clots. En este caso, secretarias, choferes, ¿ok? Normal wound healing can involve blood clot formation. Genetic predisposition is a risk factor for abnormal blood clotting. Smoking, being pregnant, being over the age of 60, being overweight or obese, or sitting or resting for extended periods, as we said, okay? Continue. Okay, so now the task will be to mention the main difference between a bruise and a blood clot. Okay? Thank you, doctors. Hi, dear teachers, students, doctors. Okay, today we're going to talk about these COVID-19 treatments, things that are coming up. And we're going to talk about this excitement around hydrochloroquine for treating COVID-19. This is a review from Brian Owens, published in April 1st this year. And they are looking for a new treatment for this disease. Okay? But before that, what is hydroxychloroquine? Well, this is a safer derivative of the antimalarial drugs known as chloroquine. And this has been used since the years of 1940s to treat these autoimmune disorders. Okay? What kind of disorders? Well, the example is the systematic lupus erythematosus, which is routinely used this drug to control all the symptoms that appear in this disease. And around 2/3 of patients with this SLE in Europe use it to manage all those symptoms. This drug is rarely used for the rheumatoid arthritis, but is the only known therapy so far for this primary sourcing syndrome. Okay, so this hydroxychloroquine has been studied as a possible antiviral for approximately the past 40 years. The mechanism of the action is until now unclear, but it is known that it decreases the acidity in endosomes, which might prevent the endosome from releasing the virus into the cytoplasm. Currently, it is used as a possible treatment for the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, that causes COVID-19. Okay? Because in China they have been researching and they found out that chloroquine could inhibit SARS-CoV-2 in vitro and showed apparent efficacy in treating COVID-19 in humans. And a small non-randomized trial in France also found that hydrochloroquine to be a promising potential treatment. The findings have prompted many, including US President Donald Trump, to thought hydrochloroquine as a game changer in the fight against COVID-19. But the US Food and Drug Administration had designated hydrochloroquine for off-label compassionate use for treating COVID-19, and who added the drug to its large global solidarity trial to test a variety of potential treatments. But so far, there's nothing really clear. Because the virologists and infection disease experts caution that the excitement can be premature. Whether hydroxychloroquine works in vivo, it's not proven for any virus, says Douglas Richman, a virologist and infectious disease physician. Because even hydroxychloroquine has shown activity in vitro against many viruses, including influenza and this new one, coronaviruses, but it has largely failed to translate it to success in either animals or humans. There is not a huge amount of preclinical data for this drug, says Tignally, and mostly it is just a test tube anecdote. Okay, this excitement about the potential treatment for the currently engulfing pandemic coronavirus disease 2019, COVID-19, using hydroxychloroquine is causing problems for the rheumatic diseases. Why? Well, some people are clearly attempting to self-automedicate with the drug with the disastrous consequences. First, hydrochloroquine can have dangerous side effects if the dose is not carefully controlled and could end in a chloroquine poisoning cases. And second, the sudden interest in hydrochloroquine had led to reports of third stage of patients who relied on the drugs to their treatment autoimmune disease. For example, the Lupus Foundation of America has called on drug manufacturers to increase the production of hydrochloroquine to ensure that patients with SLA who need the medication will still be able to access it because there are no alternatives to this medication. So, very easy. Just mention the main characteristics for hydrochloroquine and tell me please in writing what is your position about using hydrochloroquine as an alternative treatment for COVID-19. Okay? Thank you, doctors.